actually exam 2 on Thursday, 11 to 12:15 right here. So today will be a review. And I have a 3 set of the practice exam on the e-campus. And I hope you already at least go over some of them, then we'll talk about these questions, okay? The case study will typically dominant in the exam too, but it will be a similar case. It will not be suddenly some weird story there. It's all going to be the similar normal characteristics of those bacterial pathogens. So this is what going to be the format to look in the exam. At the beginning of the paper will be listed all those pathogens you will be using possibly for the multiple choice. But keep in mind these pathogen names will not be used only once, which means could be fit multiple times. So keep in mind about that. Okay, that means you don't need to worry about the spelling, and you only need to pick the number, put the A, B, C, D, whatever the answer is. So let's look at the question. Okay, and in order to help you, all those characteristics places usually will be highlighted with gold. Okay, so let's see. Oh, John, an English instructor at the university, received a call from the elder daycare, which is his 74-year-old mother was staying. Okay, this is the older people. Look at that, 74-year-old. She was experiencing chest pain, chills, and a fever. So, if you see these, typically you need to know, kind of like ammonia, because we mentioned about the pain, chest pain, fever, cloudy lung area. So that's possible, could be ammonia. When he arrived at the daycare, she seemed to be short of breath and cough. Look at the cough here, okay? Look at the cough. So you can highlight these things by yourself. So she had in the morning had worsened and became productive. Well, cough about sputum, productive cough. The local hospital prepared a sputum sample which grew on blood agar and the chocolate agar. Okay, once you see they can both grow on blood agar and chocolate agar, which means it's not a fastidious bacteria, and it's alpha hemolytic. The gram-stain revealed numerous white blood cells and numerous gram-positive diprococci that were catalase test negative, and the Opticam susceptibility test was conducted and it was sensitive to that. So possibly this ammonia caused by what? When we do this, you need to go back to review. Alpha hemolytic. We talk about basically 2 bacteria. Streptococcus pneumoniae and Viridine streptococcus. Viridine streptococcus, which means Streptococcus mitis, bovis, mutans, all those. And we said, how we separate them, we use called PDIS. And the components of the PDIS is Opticam. And these 2, this is a number 1 cap in the United States. It's a diprococcyl, and this is gram-positive. So which one will you see all these? Streptococcus pneumoniae, is that right? At the top, A, so the pick A there. Okay, so that's a question. Then, once you review this question, any similar question, you can do it. Okay, this is John, English teacher, finding his 70-year-old mother. If the exam question become 80-year-old father, it's the same thing. It will be the similar study, but the key point here is the characteristics of this pathogen, which is highlights. And the other was the red there, the red letters there, which is giving you some important information. Okay. Now, by the way, Opticam. Streptococcus pneumoniae are susceptible, and the Viridine streptococcus is resistant. Okay, so that's you need to know is alpha hemolytic strep. Okay, let's look at the second question. A mother brought her 4-year-old boy at the regional hospital. The boy was complaining of a headache, stiff neck, and a sore throat. Okay, we mentioned about when you have a headache, tough neck, well, possible ammonia, maybe other things. The boy could not look at the lights, complained it hurt see light. What this means? It's a terminology for that called photophobia, scared to the light. The boy had a fever, 103 degrees Fahrenheit, and the parent was sleeping. Okay, that very obviously could be ammonia. Oh, sorry, could be a meningitis. Okay, this is something very typical. Chest exam and the radiograph was normal, but because of the declined mental status and the history of headache and photophobia, okay, here, and the lumbar puncture was done, was showed 22 white blood cells, a gram stem of his cerebral spinal fluid, you can highlight here, cerebral spinal fluid, was performed, and Arabic culture on the blood agar and the chocolate agar find it only grow on chocolate agar. That will be the key. So if you have a bacteria grow on those 3 clinical agar, which is Macanthi agar, and blood agar, and another one is chocolate agar. If you see a pathogen only grow on chocolate agar and the others are not grow, obviously this is a fastidious bacteria. Okay? So if you look at this, the microbiologist run an XB test, and the genus species has been identified. There is a fastidious bacteria which is need. This is X, this is V, and the XV factor, they grow surrounding the XV factor, they not grow on X and V. Haemophilus influenza, very easy. Is that right? And this is the number 1 childhood disease called pneumonia. Oh, sorry, called meningitis. Meningitis. And the number 1 childhood disease. And it's a fastidious bacteria. Now, by the way, what is X? X is heavy. What is V? NAD. Nicotinamide dinucleotide. So that's the second one will be Haemophilus influenza. So you go back to C, this is going to be answer is M. Okay? Next one. On Monday, January 27, a 20-year-old female officer, okay, this is the female, assistant experienced a sudden onset of dizziness while at work, a little bit dizzy. The lady was carried to a co-worker car and began to vomiting, complaining of a severe headache, muscle ache, and nausea. Okay, look at the nausea here. So there's something happened. The lady was taken to the hospital where her condition worsened. She claimed she had not been feeling well all morning and presented with a temperature 103 degrees Fahrenheit. She developed a rash and experienced a sudden drop in the blood pressure. This is the hypertension. Okay, a drop in blood pressure. In blood pressure, there is a terminology for that, is hypertension. So there's definitely something happens there. And then the blood in the CSF, cerebral spinal fluid, was negative for sepsis and bacterial meningitis. So it's not a meningitis. Her history was significant in that she was experiencing a new contractive sponge that has not been removed since previous evening. What organism will cause? So this is the toxic shock, hypertension, toxic shock syndrome. And then he used a very highly absorbent sponge. What's that? Staphylococcus aureus. Remember TXTS, toxic shock. This is one cause hypertension and shock, which is coming from a highly absorbent tampon. Remember the horrible picture? That tells you it's Staphylococcus aureus. Okay, so this is another good example for how you do it. Then you go back to the Staphylococcus aureus, will became Staphylococcus aureus. let's say these are long stories. Then we have some short story. Okay, a gram-positive coccus was isolated from a 37-year-old female UTI, urinary tract infection. Laboratory tests indicate the organism grows blood agar with non-hemolytic results. That means it's gamma hemolytic. Catalyst test negative. Serological belongs to Rebecca Lansfield group D. So then we go back to review. Lansfield group. What do you have? Rebecca Lansfield group A. What is that? Streptococcus pyogenes. Group B. Streptococcus agalactiae. And group D. Enterococcus facilis. So what's the answer? If it's belonging to Rebecca Lansfield group D, Enterococcus facilis. That answer is G. Okay. Let's look at the next one. A 22-year-old sexual activity female. Okay, this is the key thing there. Comes into a student health clinical complaining of painful and frequent urination. This is the terminology we're going to introduce in the lab called dysuria. Difficult to pee or frequent urination. The technicians spun down her urine for microscope observation and find gram-positive coccus in the grape-like cluster. Then staphylococcus. Now, what type of the staphylococcus? Further being testing revealed the organism was catalyst test positive and resistant to novel bouncing. Okay, now this is something we want to emphasize to you. Catalyst test could be differentiate staphylococcus and streptococcus. If it's negative, it is streptococcus. If it's positive, staphylococcus. And staphylococcus, we mentioned about staphylococcus epidermis, and we mentioned about staphylococcus saprophyticus, and the staphylococcus aureus. And remember, this one, we call it the honeymoon bacteria. Remember the joke? If you know this, that's for S, sexually transmitted infection. STD, sexually transmitted disease for young ladies. And here is an example. And how we know it's 100% is Staphylococcus saprophyticus, because this is resistant to low dose of novovalcine. Therefore, it is 100% is Staphylococcus saprophyticus. So the answer here, go back to see Staphylococcus saprophyticus is right here, is L. Okay, let's look at another question. Question number 6. A 29-year-old pregnant female, that's a pregnant woman, so this is something key. You have to highlight there. Elected to have home birth. Okay, that's something. Home birth, using a midwife. She chose to have little medical intervention, delivered a healthy 7-pound baby boy. On day 5 postnatal, the baby was experiencing tremors, vomiting, and tachycardia, which is abdominal rapid beating of the heart. He refused to breastfeed and had a fever 102 degrees Fahrenheit. His urea, cerebrospinal fluid, and blood was cultured, and the blood culture and CSF came back positive for gram-positive, catalyst test negative, and the beta hemolytic. Considering the age of the patient, which patient is most likely, this is resistant to the basic tracing. Okay, the key thing is here. This pregnant woman from the newborn. So we go back to talk about streptococcus. Streptococcus, we talk about alpha hemolytic. We just mentioned. So we have a beta hemolytic. What are the two things for beta hemolytic? Number one is Streptococcus pyogenes. Another one is Streptococcus agalactiae. And we say this is related to the newborn. Is that right? Woman at 37 weeks has to do a screening test, otherwise a newborn baby could have meningitis, and ammonia, septicemia. So, what's the answer for that? Streptococcus agalactiae. Now, how do we know? Look at the hint. The isolation was resistant to the basic treatment. Remember how we differentiate these two pathogens? Using Aedes. What is the components of Aedes aegypti tracing? So, Streptococcus pyogenes is susceptible and Agalactiae is resistant. Okay? And by the way, if it's strep, catalase test negative, catalase test positive for Streptococcus. Okay, so that's something you should be in your mind. And we also have I draw on the table on the blackboard when I teach the lectures, so you should be familiar with that. Question number 7. A Honduran mother and her 5-year-old boy across the U.S. stopped a French train from Mexico, but were apprehended by the U.S. immigrant authorities. It's an immigrant baby. Shortly after being placed in immigration detention, the boy developed a sore throat, a difficult swallowing, and onset of neck swelling. So look at the neck swelling. A blackish-greenish membrane exudate was gathered in the alveoli and both tonsils. So now look at here, the tonsil area. Has a blackish-gray membrane. A throat swab was collected in the gram stem with gram-positive clap-shaped arrangement. And the swab was then cultured on blood agar with tellurite. This is cysteine tellurite blood agar. The patient's history was significant in that he had not received childhood vaccination. What is the pathogen for this? Well, if you look at that, the immigrant kids go to the United States, have a swelling neck, and has a pseudomembrane in the tonsil area, and the gram results is gram-positive clap-shaped arrangements. Then, Corynebacteria diphtheria. That's a bacteria we taught in the first class. So when you go to see this one, what you should do is go back to see the slides. Okay, then you go back all the way here. This is a very good question, because this question could review several other questions. Then you go here to see Corynebacteria diphtheria, parasites, collapsing. Okay, this is a typical diphtheria. You see a bone neck and also pseudomembrane greenish color in the tonsil area, and in the United States it's not a problem because we have a vaccine called the DTaP, diphtheria, tetanus, etc., and the pertussis. However, this is the immigrant kids, he didn't have immunization for that. So, this question you could study 1, 2, 3, 4, these 4 slides is for this question. Okay, when you do this, not only know the answer, then go back to look at the slides. And then you will be more understanding. That's 4 slides you review. Okay, next one. From Eupacimys to which organism is the most common post-surgery infection that belongs to a group of antibiotic-resistant bacteria known as MRSA. Well, this is obvious that we know about that. What is MRSA? MRSA, PSST1, and chicken salads. Is that right? We talk about food intoxication. That's one of the 3 important items for Staphylococcus aureus. So what is MRSA? Methicillin-resistant Staphylococcus aureus. And at this moment, you also could go back to review what we talk about the development of the penicillin. The methicillin is an advanced level of the penicillin. However, because it's used too much, so it has a hospitalization, contamination, we call it a nosocomial infection. There is a true nosocomial infection in this section. One is methicillin-resistant Staphylococcus aureus. Another one is Clostridium difficile. Okay, if you remember. So that's the answer is MRSA. The answer here will be Staphylococcus aureus. Okay, that's good. Okay, let's look at that. In Yavapai County, Arizona, a 13-year-old boy in the 8th grade was culture confirmed positive for pertussis and had attended school during his illness. To identify others who may be infected, a probable clinical confirmation was established for the other studies in the middle school. What are the criteria for clinical confirmation? Okay, this is something a little bit difficult. First of all, which bacteria cause pertussis? It's Bordetella pertussis. And you need to know the vaccine is DTaP. This is pertussis, Bordetella pertussis. Now, why we say in Arizona, this is the county in the Mexico and the United States border, and the 30-year-old, obviously didn't have a vaccination yet. So when we diagnose pertussis, what we do? So you go back to see the slides, and we mention about that. Nasal pharyngeal swab and the PCR test. And the whole depth of the nasal pharyngeal swab into the nose, it should be 2/2 the distance between the earlobe to the nose. Is that correct? So we mentioned about that. Remember we draw the picture there? And we draw the picture there, we talk about this is nose, this is earlobe, and this is going to be the half distance that will be depth. And we're using PCR testing, but the swab is not general cotton swab, is a nasopharyngeal swab, which is the Dacron swab. So Dacron nasopharyngeal swab, using PCR testing. So when you do this one, these two slides, you could be studied. Okay? So that the answer is B. Positive polymerase chain reaction, that means PCR, and the nasopharyngeal specimen. Question number 10. The culture-based screening method for the prevention of systematic GBS, which is group B Streptococcus lactea infection, recommends. We already talked about it. Screening pregnant women for vaginal or rectal GBS between 35 to 37 weeks gestation. So that's C. So we already talked about it. The proximal distance usually insert the nasopharyngeal swab is, I just said, is the half the distance from the nose to the earlobe. So it's C. Okay, from the patient list, you don't need to go back to see the patient list. Which organisms are now considered a part of the United States recommended childhood immunization schedule? They gave you some example. HIV, DTaP, PCV. So let's look at that. What is A? A is Streptococcus pneumoniae. Streptococcus pneumoniae, PCV is the Streptococcus pneumoniae. Okay. Second, let's look at the M. What is M? Haemophilus influenza definitely needs to. Okay, so that means D is gone. B is gone. So it's going to be A, N. What is the N? Let's look at that. Klebsiella pneumoniae, we don't have vaccine for that. Okay, Klebsiella pneumoniae, very mild symptoms for the pneumonia, responsible for 4% in the United States. So D and A are gone. So left one will be C. So let's look at the O. What is O? Corynebacterial diphtheria, DTaP, is a pathogen for that. P, Bordetella pertussis. So the answer here will be ANOP. That's pathogen considered part of the United States recommended childhood immunization schedule. So that's also will be simple. Okay, next one. What etiological agent is responsible for childhood vaginitis, tonsillitis, sinusitis, otitis, and suppurative skin infection with sequelae such as rheumatic fever and glomerulonephritis? And we mentioned about one pathogen will cause strep throat, and even you recover, you still have the disease. We call it sequelae, including rheumatic fever and glomerulonephritis. What's that? This one we haven't done yet, but it's key. Streptococcus pyogenes cause strep throat. So the answer is D. Now if you forget about this, go back to study. This is the important slide for you. Streptococcus pyogenes. The picture shows you strep throat, and the very invasive have impetigo, cellulitis, strep throat, and the rheumatic fever and the glomerulonephritis is a post-spectral disease right here. That is the answer. Okay? It's very important you go back to read the slides. So, this is first set of the question. This is given the example, the case study could be there, and also we could have some of just multiple choice. So that's why we finished. Then we're going to see the next set. The next set of question I really think is important because it is short, but it has all those key characteristics for these all passages. So we want to talk about that. First one. Again, passaging at the beginning, then we talk about the short story. A pathogen can grow on bile-excreting agar and hydrolyze excreting. There is a pathogen can grow bile-excreting agar and change black holiday because excreting reduced to excreting. What's that one? Anthracox faeces. So the answer here is Anthracox faeces. It is A. The second one. A pathogen can produce toxic shock syndrome by elaborating a toxin referred as TSST1. This is already talked about. Staphylococcus aureus. Is that right? Toxic shock syndrome toxin. So that is Staphylococcus aureus, and the answer is J. Okay? Pathogenic forms of what may produce beta-hemolysin and enzyme coagulase. Okay, which bacteria has coagulase? It's Staphylococcus. This one, catalase test, positive. Coagulase test, positive. And yellow colony on mannitol